My name is Sam Hatzenbeeler. I am a student at the Community-Oriented Public Health Master's Program at University of Washington in Seattle. Today I set out to answer some questions I have about healthcare, health, and inequality. I asked some strangers and friends, and here's what they had to say.
My name is Maitreya O'Hora, and I'm retired and a small business owner.
My name is Nakala Ayele. I'm a licensed massage practitioner.
Chris Dunkel, house cleaner.
Okay, I'm Elizabeth. I work in retail, just as a sales associate.
Oh, hell yeah.
Your health is more of like your personal well-being. As far as healthcare goes, I think it's what's provided to you to help take care of yourself.
Mm-hmm. Yeah, there's definitely a difference between health and healthcare.
Health is what happens in the body, and healthcare is the resources that you use as well as the outside provides you. And there's huge problems.
Not very well. My experience, not very well for people who don't have money. I should put it like that.
More should be provided to the public, but it's not as affordable as we'd all like it to be. But I think a lot of people also need help, and they don't have the resources to get that.
Just the fear of not being treated well, or the actual experience of not being treated well. I have a cousin that is a computer science major, and at the UW, and she had a tooth issue and went to Harborview and was totally treated like a drug addict. And, because she came in with her brother, who is also black and happened to have cornrows and all this, there was this assumption that he was a pimp or a drug dealer or all this other thing that went along with it. And, she often feels like she has to be like, hey, I'm a UW student, before she gets treated like a human.
It seems awfully messed up and highly unequal and unequitable, and but I'm excited about how the Affordable Care Act is going to affect me, because it looks like I'll pay closer to $100 a month as opposed to $550 a month.
You used to pay $550 a month.
Currently? Yeah.
Wow.
So that's a pretty vast difference. It's also money that I will, rather than be putting into the healthcare industry, will be spending on hopefully on the local economy.
I think a lot more should be provided to the public, but it's not as affordable as we'd all like it to be.
Everybody in this country ought to be covered by health insurance. Everybody should have free preventive care. Everybody in the country should have free preventive care, paid for by, the states, the feds, insurance, whatever. Free preventable care.
Single payer would go a long way towards that. Or at least a system that wasn't able to be influenced unduly by the industry.
Make sure everyone could get pretty much the same kind of services all around. I don't really know what's going on right now with the government and our healthcare system, but I would think everyone should be able to be provided with those services if ever needed, and not have to worry about having to pay for it or being just stressed out about that. I think it should be taken out of our taxes, but I think it should be, it's like if you make more, then you should pay more taxes for it. But if you obviously don't make that much, then maybe a little bit less taxes taken out of it, if that makes sense.
Well, one, I would make preventative modalities and care available before, preventative, so that people don't have to get ill before they have access to health care. All I know about the Affordable Health Care Act is that nobody knows anything about it, and nobody knows how to access it or get enrolled in it or what it means for them. I still don't know, and everyone apparently is supposed to be signed up by January 1st. No idea what I'm supposed to do, how I'm supposed to access it, and what it will actually do for me.
What's your understanding of the Affordable Care Act? Do you know anything about it?
No idea. I think everyone doesn't really know enough. Like, there's not enough facts going around, so I don't want to like listen to one person and then hear somebody else say something and then not know what it is. So until I actually look into it myself.
More health insurance access for more Americans is absolutely the direction we need to go, and I know that that's what Obamacare is going to help. It will allow so many people who don't have access to health care to at least find and look and find something that will give them an opportunity to get some kind of insurance so that they feel like they have an opportunity to go in and preventively take care of their health rather than waiting until they're critically ill and end up in an emergency room.
I think it does a lot of very good things. I don't know if it's fixable.
Mother shitter, son of a ass! You, I just...
Well, I mean, I don't know if it's fixable without pretty radical, even more radical than changes.
Another thing, just, coming from a poor and African-American background, we are scared to death of going to the doctors because we don't know if we're going to get experimented on. Like one of the things that our family, like a family, I guess it would be something like an urban legend, is like this idea of not being an organ donor because hospitals or they let black people die so they can take their organs and give them away. So my mom freaked out when she found out that I was an organ donor. Please don't tell her that I'm still an organ donor, because I told her I was going to not be one. But, it's something that, I grew up hearing. It's like, do not be an organ donor because they're going to just let you die if you're close. If you have an opportunity to maybe live, they're not going to fight for you because they want that organ.
I mean, I'm a lesbian, and I know that there were lots of years where it was really difficult for me to go to a doctor because gynecologists were traditionally men, and it was, you didn't get treated very sensitively. That's just a small piece, but people who are poor don't have access to the kinds of care that I have access to in Seattle. People of color are oftentimes disregarded by the medical profession. Immigrants, people who are here legally or illegally, are oftentimes discouraged from trying to, take good care of themselves. So I think that inequality has a lot to do with the level of health care one is able to receive.
That's the end of my video. Thanks for watching.